Now, for the next thing we are looking at as regards kidney, we look at what is known as a rapidly deteriorating kidney. Okay, rapidly deteriorating kidney. So, a rapidly deteriorating kidney just simply means the kidney is actually what losing function and is going down so fast. Like your kidney is losing function so fast. Okay, so it just refers to sudden decline in how well the kidney was functioning before. So the kidney was filtering blood, it was filtering, the waste, creatinine, there was drop in glomerular filtration rate, everything was going and is going down so fast. Do you understand? So it could be that the condition just started and is progressing towards acute kidney injury, or somebody already has acute kidney injury and is shooting towards chronic kidney disease and also the end stage renal disease. So, common causes for acute kidney injury, the things that could make your kidney lose a lot of function quickly include if you are severely dehydrated. Okay, so the amount of blood reaching the kidneys is so low, or you have an infection and this infection is what's moving through the whole body. You know, also obstructions where you have kidney stones, enlarged prostate, tumors. They can all obstruct urine flow. Then also when you take drugs that are harming your kidneys a lot, like NSAIDs, aminoglycosides, contrast. Then sometimes autoimmune diseases like Goodpasture syndrome, lupus nephritis, and the rest of it. Then sometimes there's a glomerulonephritis, that's inflammation of the glomerulus occurring as a result of infections. The immunoglobulin A nephropathy with aggressive cause. So, okay, I think, okay, I think like they're just trying to like list all the causes. Okay, this was not specially for acute kidney injury. Acute kidney injury is also a cause of it. Okay, so malignant hypertension, extremely high blood pressure that is causing a lot of pressure that destroy the blood vessels. The thrombotic microangiopathies, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, obstructive uropathy. There's also obstructions in the ureters on both sides. Okay. So symptoms and warning signs include sudden swelling. So there's swelling in the leg, in the face, you know, and the way you are making urine is greatly reduced, and sometimes you are not making urine at all. Also nausea and vomiting are also confused or weak. Then high blood pressure, and the high blood pressure is worsening. Your urine too is also foamy. So you are passing out proteins in urine, you are passing out blood in urine. So you diagnose it from blood tests where you see a lot of creatinine, urea, and electrolyte in it. Urine tests like proteins, blood, and cast. You test for it if you see it. Then imaging is where you do ultrasound or CT scan for the kidneys, where you see that the size is small. Then kidney biopsy, if indicated. So management is you give fluid if the person is dehydrated. If there's an infection, you give antibiotics. If there's a obstruction, you relieve it. If you have any drugs coming in that's stressing up the kidney, you stop them. So blood pressure control and immunosuppressive therapies like steroids, cyclophosphamide, rituximab, and also dialysis. If the kidney function is dropping and you feel like there's a lot of waste collected back in the body, you want to kickstart the body by reducing the waste. You know, so this is what we have for rapidly deteriorating kidney function.